The Ashanti Regional Health Directorate is revealing that many more young people are being infected by COVID-19. Out of 163 confirmed cases recorded in the region, 42 of them are young people within the age bracket of 10 to 39, prompting concern among officials that the disease is being taken for granted. Ashanti Regional Health Director Dr. Emmanuel Tinkran says has been given a situational report on the cases they've recorded there so far.
Situation in Ashanti region as of today, the 6th of May, is that we have a total of 163 cases with 5 deaths. All the 5 deaths were people who had comorbidities. And we would like to use this opportunity also to express our condolences to those that we lost in the country. So far, 17 of our 43 districts have reported cases. The last time we met, it was 16. Now we have 17 of our 43 districts presenting with cases of COVID-19. 56% of 163 were male and then 44% female. The youngest case that we've had here is 10-year-old and the oldest 83 years. 37 people have so far recovered and 3 are currently on admission. Most of the individuals that we've confirmed as positive are asymptomatic. They are being managed in our various isolation centers, and those whose home environment is conducive, they are doing self-isolation in the house. The cumulative contacts that we have for this 163 cases is 817 contacts. And the number of contacts that we are actively following as at now is 54. So far, Kumasi Center for Collaborative Research have tested 41,986 samples. And then out of that, we have for routine surveillance, we have a total of 227 cases. The community screening, we've been able to screen 21,558. And then the travelers that we were following, we screened 1,363. As at now, 763 people who were contacts have completed their 14 days, and we are following them up. In the course of the week, we were working basically on how to get a real-time data for all the cases. What we realized is that because of the challenges we had, the number of cases that were at the laboratories, we had a lot of backlog at the laboratories. And for that reason, we were not getting the real-time data. So now, with the support of the labs, we've been able to clear a lot of backlog. As at now, Kumasi Center for Collaborative Research have worked so hard, they've been able to clear the backlog. So from now, our hope is that we will get a real-time data. Because if we don't get a real-time data, then the case management becomes very difficult. In the sense that maybe when you take a sample today and you don't get the results as early as possible, that person may infect so many people by the time the result comes as positive. So now the focus is to get a real-time data or real-time information so as to know who to isolate and then who to discharge as far as you are a suspected case. So far, we've been able to work with the labs. It's our plan to decentralize the labs. So apart from Kumasi Center for Collaborative Research, we are also working with Ghana Health Service to set up at least 2 labs in addition to KCCR. One will be based in our public health reference lab in Kumasi South. And then we're also talking to Kofanochi to see whether we can use their lab. There are other facilities that is in Kumasi that we can put in shape. Example is the Hope Exchange Hospital. They have a lab, and all these labs, we believe that with the support of KCCR, we can now decentralize and get more laboratories so that the testing will go very fast. Because so far, that has been the major bottleneck as far as our effort to combat the COVID is concerned. So in the course of the week, this is what we have done. In the course of the week, we also had opportunity of getting other isolation centers. So far, with support from the national security, we've been able to acquire another facility that was provided by NAT. This facility is big enough. It may take up to about 300 clients. In addition, we have the TUC one, which can take 95. So when you put it together, and in addition to the other isolation centers, that means that we have about 400 bed facilities that will be for isolation.
Still on the situational report in the Ashanti region, the Director Dr. Iman Otenkran says all high-risk groups such as drivers, market women and security agencies would be tested in a new program, a new mass testing program.
This time we are going to focus basically on the high-risk group. When we talk about the high-risk group, we mean people who frequently come into contact with one another. For instance, commercial drivers, barbers, hairdressers, market women who are always in touch with people. These are those that we are going to focus on. Previously, we were using our contact tracers. Now we are going to train our contact tracers in such a way that they will be doing this job for us. So the mass screening that we are doing will focus basically on the high-risk group. And then the routine surveillance will be strengthened. The routine surveillance will be strengthened by picking more cases, people who are sick. And we've come out with the numbers that you can call anytime you are sick with a symptom that is suggestive of what? COVID-19. Once we pick that number, we will come and then assess you and then support you. So we want the public to help us. It's not the matter of coming to hospital, but even if you pick your phone and then you call any of the numbers, we will come in and then immediately support you. Then all the contacts of cases will be actively followed. And then when we follow them, we will test them. Immediately we get you as a contact, we will test you. And then we will isolate you and then wait for the test results. And then follow you up for 14 days. After 14 days, we will do 2 tests within 24 hours. Then, if all the 2 tests after 24 hours is negative, then we will discharge you. That is the protocol that we are using right now. So one person, you have to go through 3 different tests. So you can imagine a lot of burden that we will put on the labs. So that is the protocol. So the routine surveillance involves people who are sick and the contacts of these people. And then the mass screening will involve the high-risk groups that we will identify. The high-risk group, we can add the security agencies. And then any person who thinks that he is a high risk is also allowed to what? To be tested. But one thing that we want you to do for us is to address the issue of stigma and discrimination, which so far has been the major bottleneck as far as our fight against COVID-19 in this country is concerned. People who go through the protocol and then are discharged, when they go home, they are usually faced with challenges. Even when we are looking for isolation center, we are being challenged in the sense that a lot of people don't understand what we are doing. So we will have to communicate the risk so that people will appreciate why there's a need for you to be isolated, why there's that need for you to be kept for 14 days, and after that we test you. If the community don't understand what we are doing, then they only resist what we are doing, and it makes our work very difficult. Anytime we are going to pick a case, there's always a fight. And some of them do not understand, and they resort to social media to discredit what we are doing. We are doing it in your interest. Everybody is fighting together in this country. we need a lot of cooperation as far as the fight against COVID-19 is concerned. Our way is not very clear now because, as we keep on saying, this virus is a new virus, it's a novel virus, and all that we are learning is that we are learning new things about the virus. We call it evolving. The virus and its behavior and everything is evolving. So previously, people were saying we shouldn't use face masks. Now, we are using face masks because we are learning new things. So what we want you to do is that you should also appreciate whenever there is a change so that we can all move in one direction. We need to have a harmony in exactly what we are doing. So this time, we are going to harmonize the system. So the risk communication, the case detection, isolation, the follow-ups, and the laboratory testing all will be harmonized so that we wouldn't have a case where we will take so many samples and then we send it to the labs and the labs cannot work on it, and then it creates problem for us. So for the mass screening, we only have to work closely with the labs to give us their capacity, the number of testing they can do in a day, so that we will provide them with those samples. So this is exactly what we will be doing. People ask, so when is COVID-19 going to end? What I will tell you is that only God knows. That is the truth. Because if you make a mistake and you lose your guide, then it will be disastrous. So what we are saying is that whatsoever measures that we are taking so as to reduce the impact of COVID-19, we should make sure that we don't compromise whatsoever we are doing so as to jeopardize the health and security of people. If you look at our data, you realize that this time is the young people who are basically infected. It's because they are taking the risk. But the challenge is that they have old people at home. They have people with comorbidities. If you think that you are strong enough, and for that reason, even when you get infected, you only come out with few signs and symptoms, remember that we have so many people who are vulnerable in this country, and when they get infected, they will die. We've all seen from the 18 deaths that we've analyzed, even the 5 in Ashanti Region, it shows that people with comorbidities have the very high risk of what? Of dying. So whatsoever we are doing, we shouldn't be self-centered. Let's think about the health of other people so that we can work together in a team. And I believe that this will help. With the reorganization and redesigning that we've done, we are going to further train the contact tracers so as to know how to partner very well with the clients. Because if you are going to take sample, you will need to support the person psychosocially. Because people fear that if they are tested positive, they will be taken to quarantine center, they will be taken to isolation center. But we need to calm them down and tell them that we are doing this in the best of your interest. That's the reason why we are retraining the contact tracers so as to address most of the issues. If there's any organization that feels that they want their clients to be tested, they should communicate to us. We will wholeheartedly come and then do the testing for them. So far, our PPE situation is not bad, it's good. At least we have the PPEs, we have supplies from Accra. We thank Ministry of Health, supplies and the support and everything.